Good day to one and all. I would like to take this opportunity to thank His Excellency, the Ambassador of India to Kuwait, and the Indian Embassy who has given me an opportunity to share my views on this day of importance, not only for the women folk but also for the society and community at large. I'm sure everyone is aware that the International Women's Day is a global celebration to commemorate the social, economic, cultural, and political achievements of women. This day focuses around women empowerment, gender equality, reproductive rights, and violence and abuse against women. We need to recognize the obstacles women face, from structural injustices, marginalization, and violence to cascading crises that affect them, including denial of their personal autonomy and rights over their personal lives. With well over a century of history and change, the first International Women's Day was held in March 1911. International Women's Day isn't country, group, or organization specific. It's a day of collective global activism and celebration that belongs to all those committed to forging women's equality. This year's theme for International Women's Day is Inspire Inclusion. We forge a better world when we inspire others to understand and value women's inclusion. And when women themselves are inspired to be included, there's a sense of belonging, relevance, and empowerment. Collectively, let's forge a more inclusive world for women. Since the onset of the COVID-19 pandemic, the tremendous power of technology and innovation has become clear to the world. However, it has also increased exclusion, discrimination, and inequalities, especially for women and girls. When we refer back to the COVID-19 pandemic, please allow me to begin by making a mention and thanking three women: Dr. Özlem Türeci, Professor Sarah Gilbert, Dr. Kizmekia Corbett. Some of you may have never heard their names before, but we owe them a lot. They are the three scientists from Germany, the UK, and the US, and these three extraordinary women led the teams that developed the first three vaccines against coronavirus, namely BioNTech, Moderna, and AstraZeneca. And I'm sure that they, like many of us, have fought against all sorts of stereotypes. But this is how women respond to stereotypes: by going their way, showing leadership, and excelling in their field. And today, the whole world can see that we are all better off when women get the opportunities they deserve. Of course, women are made for science, politics, medicine, sports, business, and the like. Of course, women are fit to lead. Of course, career and motherhood can go together. It is obvious, but unfortunately, it still needs to be said. This year's International Women's Day is for women like these three scientists. This Women's Day is for women on the front line and for women in the back office. It is for the health workers and for the caregivers. Women's Day is for all those who no longer want to settle for discriminations, insecurity, and unfairness. As a female advocate of women's rights, I would like 2024 to bring good news to all of them. And this is what we need to work on, putting women at the center of all our policies. Providing equal opportunity to women is of utmost importance, and this can only be achieved by having more women in the labor market. But to do this, we need to make progress on work-life balance. Freedom to be a mother and to have a career for all women is what we should be looking at in the next few years. Living free from fear and violence is a basic human right, and we must ensure adequate protection for all women at our workplace, online and offline, and as well at home. Countries should invest in quality education for girls and women, including scientific education, promote sports and games for girls, as well as involve women in decision making. And finally, women should always be able to reach for the top. We simply cannot exclude half of our talents from leadership positions and talk of gender parity and women empowerment. Having women in leadership positions should become the norm, not the exception. And slowly but steadily, the world is changing. Kamala Harris, the first woman Vice President of the United States. Kaja Kallas, Estonia's first female Prime Minister. Malala Yousafzai, the youngest to receive a Nobel Prize. Serena Williams, most accomplished female tennis star of all times. Emma Watson, Hillary Clinton, Michelle Obama, Nancy Pelosi, to name a few. Slowly but steadily, we are able to achieve gender balance in the society, though it is not always easy, but we are making headway. And it shows that everything can change with tireless perseverance. All of this matters. It matters to the quality of our decision making, and it matters to our sisters and daughters. It tells them that they can reach for the top. It tells them that hard work pays off, that they will be judged on their ideas, their dedication, and their talent, not for their chromosomes. A gender balanced world is a sustainable world, not just for women, but for all of us. Being a medical professional and an advocate of feminism, I can say with conviction that women's contributions have greatly influenced medical practice. Historically, they endured marginalization in a male dominated field, yet they have broken through substantial barriers. Their path exemplifies personal determination and a changing society that now recognizes the vital role of women in medicine. According to the World Health Organization, women account for around 67% of global medical workforce. However, their representation in leadership positions remains disproportionately low. This highlights their essential role in healthcare and the ongoing quest for equal representation at the highest levels. The journey of women in medicine began with overcoming educational barriers. Elizabeth Blackwell, the first woman to earn a medical degree in the United States in 1849, faced significant resistance. Societal norms and professional biases further impeded women's progress in medicine. Women physicians were often designated to certain acceptable areas such as psychiatry, pediatrics, or gynecology, limiting their opportunities in other specialties. The struggle for acceptance and respect within the medical community was a continuous battle. The last few decades have seen a surge in the number of women entering medicine. This increase in representation is a significant milestone in the journey towards gender equality in medicine. It also represents a substantial cultural and institutional change and an evolving appreciation of the value of diversity in healthcare. Women contribute distinct perspectives, talents, and experiences to the medical community. This development has prompted medical schools and hospitals to change their policies and create more inclusive work cultures. Diversity in healthcare, especially gender diversity, has enhanced patient care. Studies indicate that female physicians often spend more time with patients and are more likely to employ patient-centered communication styles. This approach can lead to better patient outcomes, higher satisfaction rates, and increased compliance with treatment recommendations. Additionally, women bring unique perspectives to medical research and leadership. Their insights are crucial in addressing health issues that predominantly affect women. Moreover, having women in leadership positions in healthcare institutions fosters a more inclusive environment that benefits all healthcare professionals. Women's unique experiences and viewpoints are important in fostering medical innovation. These contributions demonstrate how gender diversity is critical to developing new healthcare solutions. Diversity fosters creativity by challenging conventional thinking. This results in the production of unique ideas and innovating problem-solving approaches. Studies have frequently shown that groups of people from different origins, genders, experiences, and perspectives are more innovative. In the ever-changing world of medicine, diversity is required for progress and advancement. Before we close, I would like to list out a few eminent women who have excelled in the field of medicine and which inspired me to build up the passion for the career I have chosen. Dr. Muthulakshmi Reddy. The story of Dr. Mrs. Muthulakshmi Reddy is a saga of indomitable courage and perseverance. She lived only with challenges from her birth in 1886. Born in a middle-class, socially handicapped environment, in an era when girls were born only to be married, she had to face numerous obstacles which did not deter her for a moment. She became the first woman from India to graduate in medicine in 1912 and the first lady vice president of a legislative assembly in the world in 1926. Dr. V. Shanta. Carrying forward the legacy of Dr. Muthulakshmi Reddy, Dr. V. Shanta was a legendary oncologist and a key figure in the field of cancer treatment and research in India. She co-founded the Adyar Cancer Institute in Chennai, which has become a leading center for cancer care in the country. Dr. Shanta's tireless efforts in providing affordable and accessible cancer treatment has made a significant impact on patients' lives. Her pioneering research and advocacy for cancer prevention and treatment has earned her numerous accolades and awards. I would like to make a mention here that I was a student of Dr. V. Shanta at the Adyar Cancer Institute and have had the privilege to work with her during the early years of my career. Dr. Anandibai Joshi. A victim of child marriage, at the age of 14, Dr. Anandibai Joshi had given birth to a child who passed away shortly after birth. The reason? Inadequate availability of medical services in the country. This was a defining moment in Joshi's life, inspiring her to pursue a career as a doctor. She went on to become Dr. Anandibai Joshi, the country's first female Indian physician and the first Indian woman to have gained a degree in Western medicine. Dr. Indira Hinduja. Dr. Indira Hinduja was one of the pioneers who brought in vitro fertilization techniques to India. She is often credited to carrying out the delivery of the first test tube baby in India in 1986, as well as the first gamete intrafallopian transfer child in 1988. Dr. Gagandeep Kang. Dr. Kang was the first Indian woman scientist to be elected as a Fellow of the Royal Society. This leading virologist is credited with conducting tremendous research on viral infections in children. Her work has led to her being hailed as the vaccine godmother of India. Dr. Kadambini Ganguly. Born in 1861, Dr. Kadambini Ganguly was a trailblazer and a symbol of women's empowerment in British India. She faced numerous obstacles in her journey to become a doctor, but her passion for medicine and determination led her to achieve an extraordinary feat. In 1886, she became the first Indian woman to earn a medical degree from Calcutta Medical College. Her achievement was a turning point in the struggle for women's education and equal opportunities. Dr. Ajita Chakraborty. Dr. Ajita Chakraborty is a prominent gynecologist and obstetrician who has made significant contributions to women's reproductive health and family planning. With a focus on safe motherhood, she has worked tirelessly to improve maternal health care and promote family planning methods in undeserved communities. Dr. Padmavati Iyer. Dr. Padmavati Iyer is a distinguished cardiologist known for her contributions to cardiac care in India. She has been actively involved in research and has contributed to advancements in the diagnosis and treatment of cardiovascular diseases. Dr. Iyer's advocacy for preventive cardiology and lifestyle changes has been vital in addressing an increasing burden of heart disease in the country. These remarkable women have not only achieved excellence in their respective medical fields, but have also left a lasting impact on healthcare, research, and patient welfare in India. Their contributions have shattered stereotypes and inspired countless others to follow their passion and excel in the medical and healthcare industry. Their legacy serves as a reminder that gender should never be a barrier to pursuing one's dreams and making difference in society. Imagine a gender-equal world, a world free of bias, stereotypes, and discrimination, a world that's diverse, equitable, and inclusive, a world where difference is valued and celebrated. Together we can forge women's equality and break the bias. Organizations, groups, and individuals worldwide can all play a part in the community, at work, at home, and beyond. To truly include women means to openly embrace their diversity of race, age, ability, faith, body image, and how they identify. Worldwide, women must be included in all fields of endeavor. On an individual basis, it's important to understand, value, and seek out the inclusion of women and girls. Additionally, sharing this knowledge, support, and encouragement with others is key. On an organizational or group basis, there are many ways to ensure the needs, interests, and aspirations of women and girls are valued and included. And in this spirit, wishing everyone a very happy International Women's Day. Thank you.